Thanks for the introduction. So I'm a rheumatologist. I've been in post for 8.5 years, and I'm not remotely techie or particularly IT literate even. But what I am passionate about is doing things differently and recognising that the NHS works in a very paternalistic and historic, archaic manner in the way we do things. So I've been involved for the best part of 7 years in piloting various aspects of technology to try and improve workflow and efficiency with the way I deliver outcomes that are best for patients. And I'm now leading, I'm effectively the Chief Clinical Information Officer for our trust, leading us on a path towards having an integrated digital care record. But having had a call from Martin last week, and having done this for a CCIO network in Cambridge a few months ago, what I thought I'd talk about, and there's a key word that was missing from the programme, is the how, because there will be a bit of hopefully information and dialogue sharing with yourselves, because I haven't got all the answers. But the topic is really, I think there's three key words: integration, engagement, and empowerment. And the engage and the empower fall in flow, but how do we interact and integrate what we're doing at the moment? So we're propagating a patient record, and this at the moment is just a hospital patient record, but we are hoping to fully integrate something that will be across the whole health and social care economy. So we have a single source of truth, emulating some of the work that's being done in America. And that's all about infrastructure, but as we've just been alluding to from George's talk, people are the key drivers behind this, not the technology. You need the technology as the underpinning platform, the foundation upon which you can then deliver care. But it's the clinical and business change that is key. And what we can be in danger of forgetting as we talk about systems and security and Caldecott and everything else is that ultimately it is all about the patient. Now I put to you, how many of you would define yourselves as being healthy right now? If I can have a show of hands. Based on the World Health Organization, the statement that that's a feeling of complete physical, mental well-being in the absence, and not just about the absence of a disease process. If you are, then that's marvellous, because I don't know many people who are truly healthy, because I think we are an increasingly unhealthy population. Simon Stevens talked about half the NHS workforce not being fit for purpose, to coin a phrase. So we had to take a long, hard look at ourselves, that if we were in a beauty parade and we were wanting to offer some, beauty therapy and be attractive to customers, would they come through the front door or not? And the answer may not be what we want to hear. And this is notable for myself personally, because July the 1st is a defining point. Last year I was trying to pretend to be 19 still, competing with 19-year-olds playing five-a-side football. I'm clearly not 19, and this group of 6 lads had joined, and I really thought I could take them down the wing. And it turned out that after 6 months of doing this and nursing a bit of a hamstring that was tight, and being a typical doctor, I didn't do anything about it because I'm above that, because health doesn't affect me because I am healthy. I don't suffer with disease, I treat people. I ruptured my ACL. And that was a fairly shocking experience, I have to say. And it wasn't the shock of being a patient, it was the shock of suddenly realising that things could happen to me that would prevent me doing normal things. And I was off work for several weeks. In fact, I went the following day and lectured a load of extended scope physiotherapists with some Premiership physios there, and I limped in, and I think they all thought I was putting it on. And I finished that session, and I drove back to the hospital and thought, I need to go and see somebody, because I was struggling to do anything. And the orthopod looked at me and said, what on earth are you doing? You've ruptured your ACL. When I saw the MRI scan a few days later and saw this big bloody hemarthrosis, I realised that there was a valid reason for me suffering and being a bit of a wuss about it. But I have had to recuperate from that, and it's made me realise that it's all about me. If I'm going to get better, it's up to me to do the physiotherapy and work on the physiotherapy, otherwise I'll end up needing an operation. Likewise, if I'm going to not follow my genes, the genes I've been given, then I might be diabetic. 1 in 3 of us might be pre-diabetic right now, but I might be diabetic and hypertensive and suffering not just the effects of stress but other factors in 10 years' time. My blood pressure, having had a medical, has gone up 40 millimetres of mercury, my systolic blood pressure, compared to what it was 4 years ago, just working in the NHS. and being in the stressful environment I'm working in. So whose responsibility is that? Is it the NHS's to pick up the pieces when a problem happens? Or do I need to now be predicting and preventing and looking after my own health so I can optimise what I do for my family and friends and what I do in the workplace? So this has become a key theme for me. This is Time magazine, iconic photo dissecting a $63,000 bill. And the point is the patient is one person in a whole spectrum of people. And that for me is where the integration is important. What we are moving towards is a disaster of moving from a mixed economy of paper systems to a mixed economy of IT systems that are completely siloed and don't talk to each other. So that we'll all think, oh great, we've got an electronic system. Well, it's absolutely useless if all these different people can't look at that and just look at their isolated bits, because that's not integrated care, that's fragmented care, which will lead to poorer outcomes. So integration is key on the government agenda, and whether there's multiple talks. Jeremy Hunt was over in Virginia Mason in Seattle, Washington, back in March. They're doing a lot of stuff on population health dynamics. And they're all talking about how you pioneer integration, truly integrating across the piece. But I think that's a real challenge. Symphony, patient coordinated, this is Somerset, only a population of 117,000. And all of these different bodies and organisations have come into the fray. Because what the NHS is really good at doing is managing organisations. It doesn't manage systems of care with the patient at the centre of the focus. National voices, really key. I'll just allow you to read that. But how much do we genuinely listen to the patient voice? We are all potential patients. I've been a patient recently. All of you may or may not have been a patient in the past. Therefore, you know the frustrations as soon as you are on the receiving end to how truly fragmented and how powerless you are. You're not empowered to be healthy. You are empowered almost to be unhealthy because the system allows you to do that. With huge frustrations, I saw somebody in clinic this morning who 6 months ago I discharged from an interstitial lung disease clinic that I do with a respiratory consultant, because actually we treated them and there was no further intervention other than psychological support and cognitive behavioural therapy. 6 months later, had been referred back by the GP to see another respiratory consultant who referred back to me to say, please will I sort out the problems because they've got carpal tunnel syndrome. Well, in fact, they'd had carpal tunnel syndrome 7 years ago, had it operated on, and we had repeated all the investigations 18 months ago, and they were all normal for exactly the same reasons that she's now seen another doctor and said exactly the same symptoms do. Complete fragmentation of care, but the point is people aren't listening. Everyone passes the buck and says it's not my responsibility, go back and see Dr. Price-Forbes or go back and see that doctor. We've got to coordinate it. And we've got a challenge to deliver an integrated digital care record by 2018. Post-Francis, but we didn't need post-Francis to actually dictate this. We've been striving to do this for several years now. But whether you look at Safer Hospitals, the iCare document from the Academy of Medical Oncologists, the Don Berwick report, Don Berwick responsible for accountable care organisations, the way things are going in America, and that's probably relevant to where we'll be heading, Future Hospital Commission, all of these are about patient-centred care, not disease or location-specific care. That's really important. We need systems that sit above the whole spectrum of care. And that just goes not just above rheumatology or diabetes or paediatrics, but across the whole interface of the health economy and the social care economy if we're going to truly integrate it. So accountable care organisations, King's Fund have been doing some work, and I heard Chris Ham, and I use his slides actually coming up, Chris Ham talking last week about this. And it's relevant because we've been looking at it, looking at the American system, what they're doing with accountable care organisations. And that's just a network. We are a network of interested people in health informatics and outcomes. So how can we incorporate patients into that dialogue to get networks of providers who provide the care but are joined up and have a seamless way of working that's in the interest of producing better outcomes for patients? The largest accountable care organisation in America is Advocate Healthcare, or Advocate Citizens Partners in Chicago. And they've got 610,000 patients. They're propagating a whole population health dynamic now. And they've calculated, they've got 3,300 beds, they've got 1,300 physicians, they've got 34,000 staff. And they've calculated that if they can start using the data they've got, now that they're doing population health dynamics, to predict the high-risk 40% who are likely to attend ED, to predict the high-risk 40% who are likely to be readmitted, and to relocate their care by using data and information appropriately, they will save their healthcare economy $237 million in 1 year. When people talk about there being no money in the NHS, it's rubbish. There's huge amounts of money, but it's wasted. It's wasted on duplication of effort by lots of people. Throwing 20,000 more nurses into the fray, as we heard yesterday, is not the answer. What we need to do is scrutinise how we deliver care more effectively with the resources we've currently got, because there is no more money to add to the fray. So we need to focus on that small proportion. We've heard the government talk about 120 problem families consuming huge amounts. But it probably is true that 20% consume 80% of resources and use. How can we start identifying patients, empower patients to be in charge of their health, but at the same time then focus on those who are more at risk through at-risk registers? We can then focus on improving their outcomes by putting in coordinated care and case management, share and invest in IT appropriately so we have a single joined up record of care across the health and social care economy. But most important, engage patients and support them to being well, to keep them well. And to do that, we need to align payments and incentives. And accountable care means accountable budgets, so that we deliver outcomes. We move from transactional payments, bums on seats, follow-up ratios and all that malarkey that certainly in the hospital setting we get hit for, and move towards, here's a budget, here are healthcare outcomes that we need to achieve, let's deliver those and deliver those together. Because actually doing that together as a provider network with the alliance and necessary capabilities will improve the way we alliance contracting and incentivise those outcomes for the benefit of patients. So that we focus on that customer patient experience, have a holistic view of the patient in totality. We're not just looking at a diabetic patient, we're not looking at somebody who's had a hip replacement. I had a document yesterday that came through talking about obviously the registries and having proms for hip and knee registries, etc. And I repeat the same phrase, that a patient who's had a hip or a knee replacement might have rheumatoid arthritis. And if I've not optimised their rheumatoid arthritis, or if a cardiologist hasn't optimised their heart failure, or if their diabetes hasn't been optimised by Pete, their outcomes for a hip replacement aren't going to be as good. And therefore, what's the relevance of just isolated data and information like that? We need to look at the patient in their entirety. This is a lupus patient, and all the people that can be involved, but that patient could have any condition. It's the same. Huge numbers of people are involved. We've got to empower the patients to know who to choose and when to choose them. So I think we're in denial. We're in denial about where the real answers are. It's not about the systems we put into place. It's about how do we actually engage patients in this process. Engaging clinicians can be struggling when you're introducing new IT, but actually how do we put the patient there? And whose data is it? I saw a fantastic film when I was growing up in the 80s. Richard Dreyfuss, some of you might have seen it. Whose Life Is It Anyway? About a painter who was in a car accident, and it was all to do with euthanasia. But I hear this recurring theme about data, and it's very easy. We make it really complicated. I think we should learn from Steve Jobs. His phrase was, simplicity is the ultimate sophistication. Actually, if I'm a patient, I go and see a healthcare provider, wherever, whenever, I give them access to my record, and they can look at everything pertaining to that record that's relevant to them. It's really simple. We make it hard by putting all of these safeguards in place. So we've got to prevent the car crash, because we are facing an even greater crisis than we've already got, so we've got to do things differently. I think we've got to understand all of the cultural and societal habits that lead to paternalistic care and lead patients, a lot of patients, not to be engaged in their health. We know lots are, through the use of social media. HealthKit got a bit of a look in at the Worldwide Developers Conference with Apple back in June. And they've been working, Apple have brought out this HealthKit. Lots of people are collecting data, but it's all fragmented. And there are some very informed, educated patients out there, but actually it's that 20%. It's those that haven't got access to information, to the internet, to devices, who need the most help. So I'm going to throw it out, as I've spoken for long enough. I need help because I need to understand, I'm struggling to know how we solve this conundrum of not just throwing more money, but actually how we really truly start to integrate, how we truly engage patients, and we will all be patients probably at some point in the next 10, 20, 30 years, and how we can then be empowered, or we empower ourselves to empower patients to be in control of their health. So we maintain health and well-being, and then can focus resources on dealing with the ill. My final statement: the simple field model of healthcare looks at 4 parameters, and one's health and well-being is defined by genetics, and that's roughly about 30%. Can't do much about that. It's defined about 20% will be to do with the area and socioeconomics of where you live, which you can influence. 10% is healthcare, which is what we hear politicians talking about all the time. 40% is lifestyle changes. And we don't really focus on those lifestyle changes. My blood pressure's going up, I'm putting on more weight, because I'm less active, because I did my knee in, because I'm stressed, because I'm working very hard trying to do all this stuff. I'm not looking after my own health. And I'd be absolutely gobsmacked, if I'm honest, despite your honesty up front, of how many of you are truly healthy, and how many of you don't wake up feeling non-refreshed, because 99% of patients I see do not have refreshing sleep patterns. Sleep hygiene's an issue, diet's an issue, exercise is an issue. We're facing a crisis, and we're the providers. What we're going to do to engage ourselves in this process as potential patients.